If you've been dealing with back pain and somebody, a coach, personal trainer, or maybe even a physical therapist, has been telling you that your butt wink is the reason why your back hurts, then I need you to stay with me for the next few minutes because you might actually be chasing the wrong thing. My name is Ryan Nuanced. I'm a doctor of physical therapy, and I've helped hundreds of lifters solve their own back pain and get back to confidently squatting, deadlifting, doing clean snatches, and all other types of training that they want to be doing. And today I'm going to show you what butt wink actually is, why it tends to get a lot of the blame for back pain, and what actually does move the needle for back pain with squatting. For years, coaches and physical therapists have been saying that you must keep your spine absolutely straight and completely neutral when you're squatting. If you have any flexion or butt wink or anything like that, it's going to wreck the discs in your back. And honestly, it sounds reasonable, but it's led a lot of people to either avoid squatting altogether or spend months obsessing about their squat form and trying different rehab drills while their back just still hurts anyways. What we know now is it's not necessarily the movement that's the problem, it's the volume, intensity that you're training that movement with. It's how you progress that movement, and it's how well your body is prepared to handle the demands of that movement and how you train it that's the actual issue. And this shift changes everything because instead of just obsessing about building a perfect looking squat, we now focus on building a body that is resilient and can handle what you throw at it. And that's honestly when people actually get better. So first, let's get clear on what we're even talking about. Most coaches and most physical therapists will say that the ideal squat or perfect squat technique is when you are able to squat to full depth without any noticeable spine movement or spine flexion, keeping that neutral spine position the entire time. And butt wink is what happens when at the bottom of the squat, there is noticeable flexion of the spine, so you see it round and you see your pelvis tuck underneath you a little bit. You've definitely seen this in the gym before, and maybe you've even been told that you have it yourself. But the moment someone sees it, alarm bells start to go off. You tell yourself that you're going to hurt your back if you keep on squatting that way, or that you have to fix your butt wink before you can load a barbell on your back or anything like that. But here's what you're missing. Butt wink can actually happen for a number of reasons. Usually it's one or more of these three things. Number one is just simply your anatomy, which is the big factor that a lot of people either don't talk about or don't realize. The depth of your hip socket, the size and shape of your femoral head, the angle at which it's situated, all these things are determined by your genetics and aren't really modifiable unless you feel like undergoing surgery, which I don't know if you feel the same way as I do, but I try to avoid that at any chance possible. For example, if you have deeper hip sockets, then you're going to run out of that range of motion in your hips sooner in the squat. And because you don't have that available hip range of motion anymore, in order to keep on squatting to depth, the motion now has to come from your pelvis and spine itself. The important thing to realize is that's not a technique flaw. It's just how your body is designed and the most efficient way for your body to meet the demands of the squatting that you want to be doing. And unfortunately, no amount of mobility work is going to change that bony structure of your joints. Number two is mobility limitations, which are modifiable. The two big mobility limitations that we see in our clients that contribute to increased butt wink or that will predetermine you to having this are limited ankle dorsiflexion and limited hip flexion. When you have less ankle flexibility, then you're going to have to come up with that movement somewhere, and that's going to come from the hips and pelvis itself. And on the other hand, less flexibility of the hips means that you need more of that motion coming from your ankles and your pelvis in order to still hit depth. And the third factor is technical efficiency, which is arguably the most overlooked aspect of this. If you've ever watched somebody who's new to squatting try to squat for the first time in the gym, then you notice that they're really uncoordinated, they don't know how to brace, they don't know how to make their movement smooth. And because of that, they're going to have a lot of extra joint motion, obviously coming from the pelvis and hips, but also the spine itself. So they're much more likely to have increased butt wink simply because they're not coordinated enough to know how to control their body during this movement. And lastly, there have been biomechanical studies that show that it is completely normal to have some level of butt wink and spine motion when you're squatting. There have been studies that look at the actual motion of the spine and pelvis in trained lifters who are squatting with a barbell. And even when it looks like their spines are completely neutral to the outside observer, they are actually moving through pretty large amounts of range of motion for flexion and extension and rotation, all these other movements. So even though it may look completely neutral, the spine is moving. Now, here's the thing that I want you to understand. Some amount of spine flexion and pelvic motion while you're squatting is completely normal and in many cases unavoidable. So the real concern isn't whether or not you have some butt wink when you're squatting or if your spine's moving a little bit and not completely rigid and neutral. Is your body ready and capable of handling that type of stress? The reason why so many coaches and healthcare providers like other PTs think that butt wink is such a dangerous thing when squatting mainly comes down to research looking at spine biomechanics. Researchers found that repeated flexion and extension cycles, especially under load, can cause disc injuries. And people looked at that research and said, see, spine flexion is bad. You can't have any butt wink when you're squatting, otherwise you're going to hurt the discs in your back. But there's a pretty big problem coming to that conclusion from these types of studies. The first is that those studies were done on cadaver spines, which is dead tissue that has no ability to adapt to any type of stress. And the second is that those spines in those studies were taken through thousands of repeated flexion and extension cycles, often to the end range motion until mechanical failure happened. And I don't know about you, but that's not at all how I train the squat. When I squat, I do a handful of sets with between 1 and 5 reps. I have plenty of rest in between each set, and I only squat a couple of times a week. So in my opinion, you can't take these studies that are done under very extreme conditions in cadaver spines that can't adapt and extrapolate the findings of them very strongly to how actual injuries happen in real lifters in real life scenarios. So yes, excessive spine flexion under load can be a risk factor. I'm not saying that it's not responsible for anything whatsoever, but the much bigger risk factors are things like excessive fatigue, poor training load management, and not progressively train your back to handle the demands that you're going to be placing on it. What most people don't realize is that your body basically adapts to whatever type of stress or stressor you expose it to if you give it enough time to adapt and you allow it to progress at a rate that it can handle. Think about it this way. If you don't have any training history with running, you haven't ran in weeks or months or maybe even years, and then all of a sudden you got up tomorrow morning and you decided to run 5 miles, your knees and shins and ankles would probably feel like shit. And that's not because running is inherently bad for you, it's because you're not used to running and you don't have any tolerance to that type of exercise. And squatting with some butt wink is exactly the same thing. If you've always squatted with a certain technique, whether that's a little bit of butt wink or maybe even a lot of butt wink, but you've squatted that way for a long time, you've built up your volume and intensity steadily and in a progressive manner, then your body has been able to adapt to that type of stress and it doesn't pose a big risk for you. And that's why I eventually have a lot of my clients who do have back pain train movements like Jefferson curls. We start off with very low loads or even sometimes no load whatsoever for few reps per set with slow tempos to really limit the volume and intensity of the movement, but also to expose their back to that flexion demand. And then as they're able to do that type of movement and that type of loading and volume with minimal to no pain, then we progress it over time. We slowly add volume, we slowly add intensity, we slowly increase the range of motion until they're able to train that movement pretty hard and actually develop a back that can handle the demands of spine flexion, squatting heavy, deadlifting heavy, and doing anything that they want to do inside and outside of the gym. Now, I'm not here to tell you that butt wink is completely irrelevant for back pain or back injuries. That would be just as incorrect as saying it's always the wrong way to move. And there are 2 situations when it likely does matter more. The first one is when you squat or lift with inconsistent technique. If you normally squat with no or minimal levels of butt wink, and then suddenly under heavy loads or high volumes or under a lot of fatigue, you have a ton of butt wink in your squatting all of a sudden, that's when your risk of injury does increase. But that's not because the movement of the butt wink itself is inherently dangerous. It's because you're exposing your back and your body to a type of demand or a type of stress that it's not actually ready for. And situation number 2 is if you have pretty acute flexion sensitive back pain. If your back pain gets easily triggered or if it's just severe enough and the thing that causes it to act up is flexion, so prolonged sitting, rounding your back, doing a thing like Jefferson curls, then intentionally squatting in that manner might just be flaring it up more and prolonging the rehab process. So in that case, we definitely do modify the squat to minimize or reduce that butt wink. 2 of the most common variations that I use are things like box squats or pin squats, where we're keeping that client above parallel so that we are limiting the range of motion demands on the spine, avoiding that butt wink, but also letting them train the squat over time and just progress it back to normal as their pain subsides. So if avoiding butt wink or modifying your squatting around it isn't necessarily the most important thing to do to minimize your risk of injury while you're squatting, then what is? When we work with our clients, there are 3 big components that we address. Number 1 is using consistent technique with your lifts trained over a long period of time. It doesn't have to be picture perfect technique. It just has to be a technique that allows them to lift consistently over time in a way that's efficient for how their body is going to move. When you train that technique consistently over time, you develop the ability of your body to handle the type of stress that that type of technique places upon you. Number 2 is smart training load management. This means doing what you can to avoid big spikes in training volume or intensity. It also means pulling back a little bit on the days where you're not feeling as good, pushing a little bit on the days where you're feeling pretty good, but not going 200% effort, and also not just white knuckling your way through any pain no matter what. And number 3 is developing a baseline level of low back strength, endurance, and capacity. Directly training the low back is one of the best ways to obviously build up its strength and endurance, but also prepare it to handle the demands of heavier squatting or deadlifting, especially if you're going to be in situations where your technique might slip a little bit. If you're training with maximal or near maximal loads, or if you're taking a set close to failure, there are going to be times where your technique slips a little bit. And if you don't ever directly train your back and actually build it up over time, then you don't give it that buffer of ability to handle that type of stress. This also happens to be one of the most common things that our clients with back pain haven't ever done before they actually work with us. Typically, the way that they've tried to manage or address their back pain is by avoiding loading it and avoiding stressing their back because that's the area that hurts. And while that might make sense, it just leaves them in a constant cycle of flare up, pain, rest, try to get back to training, and then it just starts all over again. I wanted to tell you a little bit about a client that I worked with not that long ago. He is a powerlifter who had been dealing with back pain for more than a year, and he had worked with 2 or 3 other physical therapists to try to solve it. And they all actually basically did the same thing. They watched him squat, saw that he had some butt wink, and then they just told him to stop squatting, and they had him do some low-level rehab drills. And for nearly the next 6 months, that's what he did. He stayed away from barbell squatting. He did a bunch of planks and bird dogs and clamshells to work on his core stability. And he did some low-level mobility work for his ankles and hamstrings, but nothing really ever made a difference, and he was still dealing with the back pain. So when we had our consultation call before we actually started working together, one of the questions I asked him is, what had he been doing to actually train his back? And the answer was basically nothing. He was so focused on just avoiding the movements that hurt and doing all these other low-level rehab drills that he never actually trained his back and never gave it the chance to build up the strength and endurance and capacity that it would need to actually get back to heavy squatting and pulling. So that was one of the main things that I worked with him on. We developed a program for him that took his powerlifting training, modified it around his injury, and then also incorporated direct low back strengthening that progressed in nature. We start with lower intensity isometric drills to give him a good entry point to this type of training, and then we slowly progress to slow tempo bodyweight exercises, and then actual loaded back extensions and Jefferson curls and ways to actually challenge his back. And within just 12 weeks, his back was feeling a lot stronger. He had a lot less pain, and he was finally able to get back to squatting and squat heavier than he had in the past year and a half because of this injury. And the best part was his butt wink was still there. It just didn't matter anymore because his back could handle that type of movement and that type of training without any issue whatsoever. So let me bring this all together for you. Some butt wink when you're lifting is completely normal and not inherently dangerous. Your lifting technique is probably not the primary driver of your injury, especially if you've trained with a consistent technique over time. The more important factors are training volume, training intensity, and how you progress over time. Your anatomy may limit how much you can even address your butt wink, and that's totally fine. Work with your body, not against it. And lastly, if you're dealing with consistent back pain, don't just keep on pushing through it. Consult with a qualified rehab provider to come up with an actual individualized solution for you. Now, I've got 2 things for you based upon where you're at. If you want to start building a stronger, more resilient lower back on your own, then have a completely free 12-week core and low back training program that's in the pinned comment below this video. It's built upon the same framework and the same principles that I use with my own clients, and that is it's progressive, it's practical, and it's actually built for lifters. Go and grab it. But if you're watching this and you're dealing with back pain that's consistently keeping you out of the squat rack or out of the gym, or you're just nervous to train every single time you step foot in the gym, then I want to talk to you. Most of the people that I work with have been dealing with back pain for months, if not years. And usually within the first few weeks of working together, we have a really good understanding of exactly what's going on and what needs to be done to fix it for good. I offer a free 30-minute consultation call, and on that call, we'll talk about what's going on, what you've tried doing, and I'll give you my honest take on what I think needs to be done to actually solve it. If working together makes sense, then great, we'll discuss what that actually looks like. And if it doesn't, then it's all good, but you'll still walk away with a lot of clarity around your specific situation. The link to book that call is in the description below. But either way, go train. Your back is much more capable than you think.